Okay, now we're recording radiology session, take 2.
Rolling. Yes. So, good afternoon, morning. We're going to do some radiographic positioning of the spine. I would like you first to be reminded of these basic ideas that I'd like to present. That we have 3 components to these X-ray exposures. 1, the X-ray tube. 2, the film or cassette. 3, the patient. All 3 of those things need to be centered to one another in order to make this work. And I encourage you to embrace the concept of setting up a field before you put your patient in here rather than put the patient before setting up. And we're going to measure the path of the central ray. That would be, so we're going to begin with the basic minimal diagnostic series of a cervical spine 3 view. That would consist of an AP axial lower cervical, an AP open mouth, and a neutral lateral. And we will eventually add to that the flexion extension laterals and the oblique views. So we're going to begin with our cervical spine study, an AP cervical. Now at this point we're not certain who our patient is, and I'm going to demonstrate what I mean by setting up our field before we begin. So all of these things we know will be true. That this is going to be at a 40-inch SID. It's going to be on an 8x10 in the button, and for demonstration purposes we're not going to place films in this, so I'm collimating inside of 8 and inside of 10, and that would be sufficient collimation, and I could collimate more if I like. And I'm placing a right marker here because I know this patient is going to be sitting, standing, facing this direction, and this will be the patient's right side, and I can leave that marker there for the AP and for the open mouth. And I suppose that we're ready now to begin. So I would have measured my patient. Here's our patient. This is Rachel, and she's our patient.
Hi, Rachel.
And I'd like to thank Dr. Bailey and Dr. Talafero for assisting me today here. And so we're going to measure this here cervical spine through the thyroid cartilage. We'll call that 9, 10. Let's call it 10. And we'll measure it through the C5 or 6 or so, and we'll call that 10. And we're not going to take a measurement for the AP open mouth, we're just going to increase the KVP by about 5%. So now, having measured, we've set up our machine, and we've put a film in here. See the film? Here. Come along now, Rachel. And here. Just for protective purposes, we're going to put this nice apron on our patient because we care. That's nice. Wrap it up. There you go. And of course we removed all this hair, and it wouldn't be in the picture because it would certainly obscure our view of the cervical spine, but for demonstrational purposes we'll just leave it there, if that's okay. And now we're moving the tube. Remember, 3 things that need to be centered. This tube, this patient. Now we're going to put the 3rd thing in a line. 3. Close this collimator down. And we'll bring forth our eye shields because we care. And we'll make sure that this occlusal plane, which we talked about from the mastoids to the upper incisors, is perpendicular to the film. And that we can see a little bit of collimation on the mandible, which of course won't be diagnostic, but it tells us where we are. That's quite nice. And I think we're ready. We check this positioning from the side, this line, and we check the sagittal plane from the front. We see that this patient is well positioned, and I think we're ready to make our first exposure. We step back to the panel. Don't move, please. Beep. Did you get that?
I did.
and the patient is staying here because we instructed them to do so. This is the same body position. Now we're going to straighten the tube. We're going to bring this light up to the level of the lips. We can leave the eye shield there. And once again, we're going to make sure that our film is centered to our ray. And notice I haven't asked the patient to open her mouth yet. It's not quite necessary yet. So, let's have you now open your mouth as wide as you can. A little adjustment here. Same lines here. Check this one in front. We can add the thyroid shield. Add them if you got them. There. You got the marker in the field. Check both lines from front and sides. Don't move. Keep your mouth wide open. Beep. That's not a little beep. Won't you step out, please? Thank you. And now we're taking this SID back here to 72 inches. And in this clinic, we prefer to use this non-grid film holder, but we don't push you to do so, since most of you don't have such a thing. And we're bypassing the grid. This is making use of the air gap principle that lowers dosage to the patient when the SID is increased. So we're increasing this SID to improve our resolution, and this allows us to do that without increasing the exposure to the patient. Now we bring our patient back here. Won't you step into my office, please? Thank you. Put your back to the board. So I'm just adjusting this film now so that the very top of this film is above the top of the ear attachment. I see now that film is placed underneath this patient's cervical spine, so that when the remnant x-rays land on the film, they'll have a place that's perfectly centered to do so. So I got 1, 2, 3, 2 things centered to one another. Now 3. Okay? And now I turn the patient to the side. And miraculously, she's the same height facing this direction as she was in the other. And for demonstrational purposes, I think I'll just cut this ponytail off. No, I'll just, I'll ask her to hold some weight to pull her shoulders down. Yes. Here, have a weight. There you go. And the idea of this is to pull her shoulders down and give us a better look at the C7T1, and I'm using my finger in the shadow on the spinous process to make sure that it's being included. The spine is in the back. If you're centered over the face like this, you're missing it. Okay, the spine is in the back. So I see it here, and I walk around the front of my patient. And the eyes are straight, the sagittal plane is straight, the eyes are perpendicular to the film, the light, the thyroid shield is placed, the eye shield is placed. I'm going to put her in a neutral position. That same occlusal plane is now parallel to the floor. That's a nice neutral position. Last minute check, see C7 shadow in the field. Tell her not to move. And beep. There. So if we wanted to go into flexion extension now, we could have the patient stick your chin out as far. Of course, we changed the film while we were doing this. We stick your chin out and bring your head back. That's nice. Don't pull, don't push, okay? And same thing. Check the body from the front, because sometimes patients just antalgically kind of list one way or the other. You want to make sure that they're straight. This is a nice extension. We change our film, relax, and tuck your chin, bring your head down. And for this one, we want now to bring this spinous process all the way back here to make sure that she doesn't flex right off of the film. And I'm going to turn this collimator just a little bit to make sure that that doesn't happen. Align it better with the spine. Here we see the shadow of C7 in the light, and we see some light up in front, and this line being over the spine. We're good. Flexion extension, okay? That's that. Thanks. And now while we're here, I think we're just going to do this, these oblique views. Why don't you step out for just a moment? Come hither. And swing around there. And sit up real straight. That's the sound of position. Real straight. And this central ray is to mid-cervical, and it should be a little bit slightly above where you hope it will exit because it's being angled down. This is an LAO position, and it's going to demonstrate the left cervical IBS. Now the film and the ray are centered to one another. And we have eye shields. Yeah, so the sagittal plane is straight, parallel to the film, eyes are perpendicular, same neutral position, occlusal plane is parallel to the floor, and visually we see that we have the cervical spine. Once again, this is an anterior position, anterior oblique position. It's a PA projection. This is a left anterior view of the left cervical IBS. And with it, we would do the right anterior oblique position. It's always a bilateral study. The cervical spine, 7 views. A Davis series. I don't know who Davis is, but it's a Davis series. Thank you.